efforts to embrace a new normal are running into a few huddles. The number of seriously ill COVID-19 patients is on a relentless rise here on the local front, while over in Europe, the number of daily cases is rebounding to record levels. For more, I have Professor Kim Moon-gyu from Yonsei University. It's a pleasure to have you back, Professor Kim.
Nice to meet you again.
I also have Molly Quell, a freelance journalist over in the Netherlands, live on the line. It's a pleasure to have you with us, Molly.
Good afternoon.
Right, Professor Kim, we'll start with you here in the studio then. What do you believe is the reason behind the rapid rise in the number of seriously ill patients on the local front?
I think almost all countries changing quarantine policy to with corona are facing the surge of COVID-19 cases, not only Korea. Theoretically, if the surge is composed of mild cases, there will be no burden for the ICUs, intensive care units. The key issue is how to ease the quarantine measure without compromising COVID situation. And we can prepare for the worst with equipping more facilities like nasal high flow, ventilators and ECMO and CRRT, etc. But we must remember that this must come together with the manpower. We have very low reserve for medical personnel who are well trained to deal with that severe cases, persons who can deal with that machines also. So they are already overloaded, and because of this pandemic, there are many nurses and doctors quitting their jobs who work in that intensive care units. And this is not only the problem with Korea. I think most of the countries with severe cases are facing the similar situation. So I hope that we learn from this pandemic that we need a reserve of those medical personnel, and to prevent the increase of severe cases will be the best solution.
Right, it would be. Molly, like I mentioned earlier, daily COVID-19 tallies over in Europe have been escalating in recent days, and I believe the Netherlands hit a fresh record with over 16,300 infections on Thursday. Tell us more about the COVID-19 situation there and efforts by medical institutions to better respond to the situation.
Yeah, we unfortunately broke our daily record for the pandemic yesterday, as you mentioned. That's higher than it was in December of 2020, the number of daily cases. We had 26 deaths yesterday, and I guess it's probably important for your audience to remember that we're about 1/3 the population size of South Korea. So it's about 17 million people that live in the Netherlands. We have a lot of people in the hospital, a lot of people in intensive care, and earlier in the week, at least one hospital has declared what they call a cold black, where they're turning away patients because they're fully at capacity and they can't treat people anymore. And this is becoming a more serious problem, especially because neighboring countries like Germany and Belgium are also having quite full hospitals and a bit of a resurgence. So there's not a lot of capacity for patients in the Netherlands to go somewhere else if the hospitals here are full.
Are there any efforts on the part of the government then, Molly, to perhaps beef up support within the medical arena?
Yeah, they've been trying to expand ICU capacity, the intensive care unit capacity here during the duration of the pandemic. I think a bit as your previous, the person who was previously speaking just mentioned, what they're really having a struggle with is the number of medical personnel. They've been having a lot of problems sort of keeping people, nurses and doctors in the field. It's been quite difficult time and very stressful period for them. So they are trying to do things, but it seems like what is being done is not sufficient to keep up with the rate of infection.
Right. And staying within the medical arena, that is, Professor Kim, authorities have mentioned that the country's medical system can accommodate up to 500 seriously ill patients, and we appear to be nearing that figure. What are your prospects with regard to the rise in severely ill patients? Do you see a further rise? Do you suppose the figure will stand on the 400 level?
There is a high possibility that the severe cases might go over 500. I would say that there is no break to stop the surge if it gets the speed and inertia. So the worst scenario might be like exponential spread which Israel and Singapore and Germany has experienced, we do not have many options except vaccination and social distancing for now until we have new drugs available. Again, vaccination for high-risk groups and if they are unvaccinated, and also booster shots for these groups are urgent right now.
Right, as mentioned by our colleagues earlier on. Meanwhile, Molly, how are authorities in the Netherlands explaining the persistent rebound that is in daily infections in Europe or in the Netherlands itself?
Well, there's been the Dutch are a people that believe very strongly in personal responsibility, and the party line sort of the current government is that the only way out of this crisis is for people to sort of adhere to the measures that are in place, and that they have to stick to the rules, and they have to sort of use common sense. The situation in the Netherlands is sort of similar as it is to surrounding countries, Germany and Belgium, Luxembourg, Austria. These places are also having a huge rise. I mean, it's winter here. It is cold and wet. People are indoors. I think that leads to a situation where you're inevitably going to have an increase in infections in a respiratory pandemic.
Right. And that is why last week, Dutch authorities, Molly, I believe, reintroduced face masks and expanded the list of venues that require what are being called corona passes there and not vaccine passes. Tell us more.
Yeah, that's correct. So last week on Tuesday, they put forth some expanded measures where, as you mentioned, they're now requiring face masks again in shops. They had only been required on public transportation for a long period of time, and are also requiring more and more places to do it what they're calling here a QR code check, where basically you either have to show that you've been vaccinated or that you've tested negative within the last 48 hours. And tonight, there's going to be another press conference where they're going to have to introduce some more measures. At the beginning of the week, they were, I think, floating some looser restrictions, maybe just a bit more of this QR code testing and a few other things, perhaps reducing the size of events. But given yesterday's daily record, I think they're going to have to do some things that are a bit stricter.
Right. And Professor Kim, a weekly analysis by the WHO shows Europe accounting for more than 60% of all global infections during the first 7 days of this month, that is November. What are your thoughts on the resurgence over in Europe?
If there is an increase in critical cases, this is very worrisome. Many European countries show a surge in COVID-19 cases, such as Netherlands, Germany, and there's a mild increase in France, Italy, and Russia. And I think Sweden is in a stable situation, and there's a little bit decrease in UK right now. Each country needs evaluation and analysis, but there might be possibly related to the easing of social distancing with the other weather factor. We have to remember that the majority of European countries are already vaccinated, and they even started booster shots. I hope that mortality will not increase together with the total cases, but Russia, UK, Germany, Netherlands, they're already showing the pattern of increasing of the mortality. So wearing mask will be more important than we think, and maybe we have to continue that all through this pandemic.
Right, and along with wearing masks, Molly, later on this Friday over in the Netherlands, authorities will decide on whether or not to impose a partial lockdown. I understand that will last about 2 weeks. Could you tell us a bit more about the measures within the latest proposal of a partial lockdown?
So what has leaked sort of from the government as of yesterday is that they're actually looking at a 3-week lockdown. They're talking about closing bars and restaurants at 7 o'clock. It will expand the use of QR codes to include places like zoos, and that they're going to talk about canceling events, large events with people, no sort of public at sporting events, this kinds of things. It seems likely that schools will remain open. And next week on Tuesday, the Parliament will debate some further measures. There was a number of things that were introduced here, like the mandatory social distancing rules. They were implemented under an emergency law, and in order to bring them back, they're going to have to change the sort of legal justification for it.
Molly, how is the public responding to the possibility of another partial, though, lockdown?
I mean, I don't think anybody is happy about it. I don't think anybody enjoys sort of being in lockdown. The Netherlands, I think, like a lot of countries, has a small but very vocal minority. There was people who were out protesting last weekend, about 20,000 of them against the corona measures. But more broadly, people seem to accept the idea that we need to do something. I think a lot of people know people personally who have gotten corona in the previous days. I mean, with these sorts of numbers in such a small country, inevitably you're going to know folks who have tested positive. And when I talk to people, when you see people being interviewed on the news, they begrudgingly seem to accept the fact that like we need to do some more things here. So, I mean, I think most people will sort of accept what needs to be done.
Right. Professor Kim, compared to Europe, where exit strategies saw a near complete lifting of all prevention measures, Korea's transition into a new normal has been rather cautious. The wearing of face masks is still mandatory here, and business hours are still being restricted for some entertainment venues. What are your thoughts on this discrepancy?
COVID-19 is different from previous beta corona viruses, such as SARS in 2003 and MERS in 2012. It can actively spread before symptoms starts. So that's the key point we have to remember. Personally, I agree that easing quarantine measures should be gradual, especially for people gathering in a confined space. A lot of drinking, speaking, and might have close physical contacts. But elementary school and junior high school might not be closed again, because I think there is more loss than gain. And instead of that, as I mentioned, taking care of the high-risk groups and keep continuing vaccination program will be important.
Right. Molly, meanwhile, the decision by authorities there in the Netherlands to lift COVID-19 measures completely, well, to embrace a new normal, was on the back of the country's high vaccination rate. What can you tell us, Molly, about that rate right now?
So the number of eligible people to be vaccinated in the Netherlands who are fully vaccinated is about 85%, 84 point something. And the number of people with the first shot is a bit higher. I think it's about 87. Amongst the elderly, that number goes up even more. It's sort of around 90%. And even kind of teenagers, they sort of opened up the age range eligibility a few months ago, so that 12 to 17-year-olds could also be vaccinated. And there, it's somewhere about 60% of that population is vaccinated. So the numbers here are vaccination rate is quite high. Obviously not high enough, because we still have unvaccinated people, and those are making up the majority of the people who are in intensive care. But it is much higher than it is in some other places.
And are there any other efforts, Molly, being made to perhaps further encourage members of the public to take vaccinations, to receive their vaccines?
Yeah, they've been pushing for a lot of these things. They've been doing some things where they're sort of taking vaccine buses into neighborhoods where they don't have such a high a rate of vaccination, to try to encourage people to get vaccinated. I live in a town with a big university, and they've set up some places on the university campus where people are eligible to get vaccinated. And there's a push here also to get younger people vaccinated, so to open it up from 5 to 12-year-olds like they've done in the United States.
And what is the response to that, opening up vaccinations for those children below the age of 12?
I think people seem broadly positive about it. I mean, again, there are people who are sort of vaccine hesitant or skeptical about getting vaccines, but they're a small sort of portion of the population. My impression from people who have young kids is that they want their kids to be safe, that it seems like the vaccines are quite safe, and that getting their kids vaccinated will get us all out of this situation faster.
Right, hopefully. And Professor Kim, what are your thoughts on the possibility of an alarming rebound in cases here in Korea, as is the case over in the Netherlands, as we push forward with our gradual ease in COVID-19 prevention measures?
There's ample evidence that Korea might have the same surge of cases. And one thing I would like to mention is unidentified infections. I mean, we have unidentified cases because it might have an asymptomatic infection, and nobody knows the whole picture of that. And since the Korea maintained in a very good situation for a long time since the pandemic, so we might have less unidentified infection compared to Netherlands and other European countries. So if we have a surge, it might have a real big impact in Korea. So we have to consider that risk, and easing quarantine measures is something should be our own. I mean, Korea has Korea's own situation, so I think the government is considering, and they will make conclusions soon. Yeah.
Right. And talking about the government here, Molly, authorities in Korea are underscoring the importance of booster shots to fight off breakthrough infections. How is the booster campaign being implemented over there in the Netherlands?
They've opened up booster shots for the elderly and people who work in healthcare, and also for people who are living in sort of care home facilities. And those shots are going to start in December. There's been a bit of criticism here about that because, of course, places like the United Kingdom have already started with booster shots. And I think people here would like to see this being rolled out a bit faster, but that is the current plan.
I see. Meanwhile, Professor Kim, COVID-19 vaccinations may become an annual event here in Korea, as is the case of the seasonal flu inoculations. And if that is the case, what are some things worth considering before making COVID-19 vaccinations an annual event here?
The pattern of this pandemic will decide the need for yearly vaccination, whether COVID-19 vaccine should be repeated annually or not. But before we conclude about this, we must have more data on the safety and effectiveness of the vaccines which is currently available. And we also have to look for new vaccines which has a comparable effectiveness and also maybe have better results, such as Novavax. We don't know yet, but. And we need to make efforts to make new vaccines which might cover the possible future pandemic also. And if it goes successful, it might cover the whole family of a beta coronavirus. And they will put a name on this vaccination as a pan-corona vaccine. And I hope that will come in the future. But we have to come back to the same story that comparing benefit and harm. So always benefit should be more than harm to start any kind of vaccine program.
Right, of course. Molly, one final question to you. As you mentioned, schools will remain open in the Netherlands, even in the event of a partial lockdown. What measures then are in place within the academic arena to ensure safety there?
They're requiring mask wearing for high school and also at the university level. So when you're sort of moving around in the classrooms, there's some restrictions on the number of people who can be in a single room. So, for example, in the school canteens and these sorts of things. And they've been trying to stagger arrival times to sort of ease the burden on like public transit and congestion, to kind of minimize the number of sort of large groups of people that are kind of gathering before school or in one small confined space before school.
What about the idea of remote classes taking place? Is that an option on the table?
I mean, this is what they had to do earlier during the pandemic. So I suspect that that will be an option that's put back on the table if the numbers keep going this badly. I mean, I think broadly speaking, parents have been very frustrated with this, and that nobody is really enjoying the remote schooling situation. I think it's quite difficult to sort of do your job while you're trying to make sure your 7-year-old is learning maths. So I think we'll see. They've still been continuing some remote stuff for students who are really at high risk, sort of people with severe asthma, that sort of thing. So I think it could continue. I think it's just, very important. I think that most people, that children go to school. I think the educational experience is better. This is kind of what the experts say. And so I suspect that that's really going to be a measure of last resort for them to return to some kind of remote schooling.
Right, I see. And finally, my final question to you, Professor Kim. Korea itself is planning to fully reopen the academic arena on the 22nd of November. What are your thoughts on this as a medical expert yourself?
Well, vaccine is necessary for some students in that age if they have underlying disorders. So some parents are reluctant to get vaccinated, but I highly recommend that they should have a corona vaccination if the doctors are recommending. And what about the healthy students attending elementary school and junior high schools? Well, from the Academy Social Society of Pediatrics in Korea, they are insisting that parents should be fully explained, and they have to agree, then understand the whole situation, the benefits and the side effects, and students should be vaccinated somehow, at least once, I think. That's my personal opinion.
In order to ensure complete safety within the academic arena then?
Yes.
I see. All right, Professor Kim, as always, thank you very much for your insights. And
Thank you.
Molly, thank you very much for your time and your thoughts at this very early hour at your end.
Yeah, thank you. Enjoy the rest of your afternoon.